It's Wednesday morning. It's 23 in front of 9. Let's bring in our good friend, Dr. Joe Congini, Sports Medicine Center at Akron Children's Hospital. We like to talk sports medicine with Dr. Joe. Joe, what do you have for us this morning?
Hey, Ray, when you're going through that weather report, could you please warm it up for the weekend a little bit for some of these sporting events, and especially Friday night football with a lot of us out there? Try to warm it up a little bit, would you please?
I will do my best, my friend. I will certainly try.
Because there's a long way to go in high school football in Ohio. You know that we are moving into week 12, but this playoff system goes pretty far into, it can go all the way to 16 games, so there's still a ways to go. But one of the things, we had our twice a year Ohio High School Athletic Association Joint Advisory Medical Committee meeting, and there were a bunch of topics talked about that would be interesting, I think, for people to know about what the decision makers are trying to come up with changes and things to keep it interesting, keep kids safe. And one of the ones that's important to me in the safety realm is the looking at the new guidelines for what they call, Ray, extending the window. And that means increasing the number of team practice sessions, which was approved this year. And it went up to 13 extra practices for team sports. One misconception is a lot of people think this is just football, and it's all team sports. Soccer, baseball, basketball, all played extra sessions. And we went around the table and kind of got a sense from people as to what some of the effect of that would be. Of course, the ultimate effect that everybody would ask us was, what did it do to the injury rate? Were there more overuse injuries? Were there more traumatic injuries? Were there not more injuries? And that these kids were in better shape and endurance. So we won't have those results. And in fact, there's a couple of groups that are kind of looking at their own piece of the pie, but we don't have those results yet. Of course, we need research. You can't just say, hey, in my world, at one school, there were more injuries or something. We need to look at all 88 counties in Ohio, and that's being done. But a couple of observations that I thought were interesting. Number one, part of this came from the issue with COVID, where there was the big shutdown and so many teams got practices and games suspended and no ability to play. So the following year we had to increase the number of practices, and then some of the people kind of liked that, so we continued that. So it goes back to the COVID days. But one of the things interesting to me that some of the coaches, the trainers, the medical people observed is that there seems to be perhaps more kids that stayed with their school-based teams and did not jump over to some of the club teams like AAU basketball or JO volleyball or other things like that as much. On the flip side, some people said, well, they came to the team practices, but then they also continued on with AAU and JO, and then they overdid it and leading to overuse injuries. But that was an interesting observation that maybe it keeps the school-based teams together for a longer period of time. Secondly, some people thought, and this was interesting to me too, that there was a lot less pushing the envelope of people, in other words, doing practices they shouldn't have been doing, sneaking in a couple practices, if you will, where they needed more time with their teams to teach. And now there isn't as much of that behind the scenes, pushing the envelope, sneaking extra practices, because you get 13 extra practices this year, and people felt that part went down a little bit. And so that would be good. One other thing that I found interesting, a lot of coaches kind of discussed within themselves about what's the strategy about how to use that time the most. The window really increased this year from May 15th to July 31st. So you could use those practices a lot early on, like May and June, and then give your team off before regular practice started July 31st. Or a lot of people packed them in at the end and really wanted to use that second half of July or early July right into the season. And it will be interesting to see as we look at the numbers as to which one of those strategic approaches was most helpful. But the most concerning thing to me, number three, Ray, that I got to mention is the athletic trainers really jumped up and mentioned this one, is with the extended season now going pretty much year-round, and it comes together with the fact that we have a significant trainer shortage, as trainers, as you know, have gone to master's level, 2 extra years of training. Many of the programs throughout Ohio and throughout the country have had significant drops in athletic trainers going through their programs. And a lot of people said a lot of athletic trainers, even coming out of the end of the program, are getting into things like medical sales or other 9-to-5 jobs, instead of those jobs where they work so hard till 9 o'clock at night or working all weekend. And a lot of people said that the time they had the least coverage were those months of June and July. And I've got to tell you right now, that really concerns me, because June and July, when new athletes who go out there, maybe who have never played before, or athletes who aren't in very good shape, or the heat of the summer, those are going to be the kids that are at most risk to have a significant problem. And those were the practices that a lot of people said, they heard from a lot of people, were not covered by trainers over that 6-week period. And so that really, really worries me, because that's the most important time for us to have those trainers' eyes on those kids for those catastrophic injuries that can occur. So I made that really clear with Emily Mason, who's running this project and doing a great job down at OHSAA. That was my biggest concern of everything that was discussed at the meeting this past week.
And it makes sense, Joe. Did your request get met with open ears? Did they understand the need, and hopefully the schools can make the adjustments to have the trainers there?
They absolutely. I mean, they were the ones coming to beg us. The trainers were, the coaches, the medical people were. But right now we're in a little window. We're in a little period of time. There's just not trainers available. It's never been that way in my 36-year career. There has always been plenty of trainers around when we go looking and needing to fill schools with trainers. And for the first time ever in the last 2 or 3 years, and it doesn't seem to be getting better, there just are not enough trainers around in certain areas. And there's teams that have gone whole years without much coverage or any coverage at all. And so that's a problem that really needs to be solved. We need to look at how to do that better, how to get those roles filled, how to get maybe better pay for those athletic trainers that are out on the field so that we do have them available. So that, to me, was job one and number one concern, red flag that I saw. But the rest of it is a lot of hardworking people trying to do a good job at the OHSAA, getting a good experience for our school-based athletes, and overall I think doing a pretty good job.
All right, Joe, great information, and really, way to attack that issue and being forefront, because I think you're spot on with your feelings about how these young athletes could get exposed. So commend you for taking some action on that.
Thanks, Ray. Have a great week, and warm it up for the weekend, would you please?
I'm working on it as I speak. I've got my Flintstones and my sticks. I'm ready to go for you.
All right. Sounds good, Ray. Have a good rest of the week.
You too. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital.